Hey guys, I'm Sebastian. I thought I would share with you a couple different exercises you could use to nearly immediately reduce lower back pain, especially if you have it in the morning hours. It's worse when you get up out of bed, when you tie your shoes, bending forward, and especially things like turning and twisting are bothersome with it. These are exercises that I've used throughout many different patients and many years at my clinic in Orange County, California, and we've done a very good job with lower back cases, and so I thought I would share a couple with you today. This is a follow-along video. Obviously, if this is not a diagnosis I'm giving you, you should be seen by a doctor, not necessarily a medical doctor, but you can be seen by a therapist, a chiropractor as well to help diagnose your condition. Now, this is a follow-along video mainly because I want you to see that there is actually a big possibility of improvement. Many people are in disbelief they can actually feel better because they've had this thing so long and they've failed surgery and injections and other types of care, and that's just not the case. We see people over and over again in our clinic who do very well with our type of care, our active type of care, and it's things you can certainly do at home. These aren't things you necessarily have to be in the presence of a therapist or chiropractor or trainer to do, but it is always helpful to have someone around as well. So what we're going to talk about here is first a little bit of the structure of the spine, but we will go into the two exercises that I like for most people. Obviously, it's not everything. These are just two exercises out of the book I just finished. You can get this for free at the bottom. There's going to be a link that comes up in the video somewhere, up into the top corner, but also in the link description at the bottom. You can get it for free. All I ask is you pay for the shipping is all. So it's my gift to you, and these are two of the exercises, but remember, if these exercises don't work for you, it's only a couple of the ones because there are 6 really powerful exercises in that book that you should take advantage of. So the first thing we have to consider is that, number one, the spine has a couple different structures in it that most commonly are associated with people's lower back pain, and this happens at various different ages. Now, you might have been told you have arthritis or degeneration or so on. I wouldn't worry about that stuff, and I know some people might laugh, don't worry about it. No, we consider it gray hair of the spine. Gray hair doesn't hurt, it's just there. It's signs of aging. We know a lot of people who do not have any lower back pain, and they have quite a bit of arthritis, and other people who are younger, who are into their 30s, who don't really have any arthritis but have a lot of back pain. And so they're not really necessarily related to each other. This model demonstrates, especially in this pink area, these are the vertebral bodies. These are the lumbar spine disc, or intervertebral disc we call them. The yellow represents the nerve roots that come out, and then there's the back side of the spine. I'll see if I can get it in focus. These are called the spinous processes. These are the things that move right there, those little joints that kind of move up and down. Let's see if we can focus that guy. I'll go this way, make sure so these joints that move up and down like that, these are the facet joints, and a lot of these things have been blamed for people's problems too. What I want you to notice is that the spine is dynamic, it moves, okay? As you bend forward, it opens these little holes right here, and the facet joints slide. As you go backwards, they close. And the same thing happens with twisting and bending to the side too. So a lot of people do have a mechanical reason for their back pain, even though they might be told it's in their head. Now, probably the most common reason for lower back pain that's unresolved that we see in our office is low back disc, I'm going to call it irritation, because many different types of disc irritations and herniations and protrusions and prolapses, and don't worry about all that stuff, because most of you, if you don't have severe signs and symptoms, it's an ache that just won't go away, or even if it puts you to the floor, a lot of times it's just a simple disc, a low-grade disc. Now, can a disc get better without surgery or medication? Yes, we see it all of the time. Current research shows that yes, it can. I'll explain in this model right here how that works. By the way, I know a lot of talking, but I'm hoping that you're getting good information at this point, better information than you have in other places. So don't fast forward. I encourage you to not fast forward. Learn a little bit. I'll only spend a couple minutes on this, then we'll go into the video, of the exercises rather. So this section right here is this guy. It's the front of it. Okay, here's the front, here's the back. And so I'm just going to yank this guy off here, and let's see if we can get the camera to focus on it. So this, again, we have our vertebral bodies. Above and below, we have the disc. This model is nicer because it really shows the movement-based aspect to it and why things like bending forward could be creating your problem and essentially picking the scab. These are the nerve roots right here. Here's the facet joints that will again slide, and here's the hole in the middle called the foramen. Foramen actually means hole in Latin, if I recall it. And so you might have seen things on your MRI or X-ray that says foraminal stenosis or things of that nature. Don't be too worried about it. Those are, again, gray hair of the spine. Not everybody has pain with it. If you're concerned, you can always have someone like me help read that to you and figure out if it's actually contributing to your pain or not. Now, what we find here a lot of times with people, and this is not everybody, I want to make sure that you understand this, is that not everybody has this type and reason for back pain. It's just a lot of people do. There's other types of back pain, but I'm gonna basically categorize this in the 70% of you who are watching this. This is probably in the high probability of what you're dealing with. Whether you have an image or not, it doesn't matter. You can still resolve this thing without an image. But there's other types of back pain too that won't be in this video. Now right here we have this, we call this a disc issue. I'm going to call it a disc issue. See that little jelly coming out of there? And so I'm going to squeeze it pretty hard. And you see that jelly kind of moving backwards, right? And so if you look down the center of this thing, there's the jelly right there. I consider it a little bit more like tar. It's slow moving and doesn't really move extremely quick, but it can move backwards. And so when it moves backwards, it can sometimes create some irritation of this nerve root right here as it might kind of contact on it. I got to push it harder to make sure it there we go. So now we're contacting on it. All right, so this is a forward bend movement. This is putting your shoes on, especially first thing in the morning when the disc has a lot of jelly ability. Later in the afternoon, it doesn't have as much jelly ability. So a lot of times people, first thing in the morning, they'll have this problem. This can create your sciatica, even your piriformis tension, your hamstring tension, your calf tension, your foot numbness, your IT band that won't go away, your hip flexor tightness. This nerve root pressure can make a lot of the muscles down the chain, down the leg, feel like they're super tight. And that's really common. And so you don't necessarily have to have it, but a lot of times this disc herniation or a disc issue type of presentation, it will look very much like all these other syndromes that you've seen, like your SI joint, your hip flexor, your hip impingement, your high hamstring tendinopathy, your piriformis syndrome. A lot of times if we reduce this disc issue, then a lot of times all that stuff just melts away. It's just gone within weeks to months. And I'll show you one more thing here, is that what we want to do basically in some of these exercises is we want to just limit the amount of forward bending by adding some more extension. And so an extension pattern. And so you see what happens when I extend this individual is that area right there doesn't actually come out anymore. And so what we want is enough time, just enough time to get the area to scar up, to physically scar up. In this case, a scar is really good. And so what a lot of people end up doing is they end up picking the scab by doing the activities and stretching maybe too much. And so the exercises I will show you right now, we'll go through it in real time, are going to be helpful for decreasing picking the scab. I know it's going to sound very extreme, but we've had people just by using a couple of these protocols have instantaneous improvement by about 30 to 50%, sometimes much more, and people dramatically change how their symptoms feel within about a week. Okay, it can take longer. All right, I'm probably giving you the higher end of improvement. People tend to improve really quick. I know I did. I had a disc herniation, and I improved 75% subjectively within a week period of time after implementing these exercises. It wasn't the end of it all. All right, it was just the beginning step of improving to settle the area. Movement compensations, muscles fighting to help out, the glutes turning off, hip flexors getting tight. That's all movement compensation we need to address a little bit later. And as I lay things out in the book here, what we want to do is actually, we want to do number one, this is modify pain. And so what we're doing in these exercises is we're modifying pain. Next is you want to activate your support systems, which is basically going through specific exercises on the floor to start with, and then get out of them, because a lot of people end up doing these exercises way too long, and they end up not really getting their body prepared for doing things like playing basketball and running, because those are all foot on ground activities. Next is we want to pattern a movement, because it's really hard to pattern a movement if you're in pain. Pain corrupts movement, We know this. It's hard to get the perfect movement and get the glutes to turn on and everything if you're in pain. That's why we're modifying pain quickly today. And the last thing is adding load. The body actually likes load, okay? Load is not included, at least in this book, and I won't talk about it too much in regards to this video because it's well beyond, if you're watching this video, it's well beyond what you should be doing at this point. But things like goblet squats, split squats, even deadlifting, carries, things of that nature can be very helpful to your problem. But you do it too soon, without modifying pain, without building support systems, then you're asking just for a little bit of a relapse. Remember, your body's not broken, it's just sensitive right now. These little things can be sensitive, nerve roots can be sensitive, the facets can be sensitive. All we gotta do is settle that thing down and we're off to the races. So let's get into those exercises and then we'll cover everything a little bit more detailed at the very end. Okay, so the first exercise I like to start people with is a little bit of an assessment, but also too, it's a therapy that we tend to give. And I always start this with my clients. I say, look, I'm not married to this idea of working. It's just a high probability thing. If I went to the casino and I decided that, hey, I'm gonna gamble all my money on the slot machines, I know beyond reasonable doubt that that probability of me winning is actually fairly low. And so I like to pick the higher probability things. Not that I gamble, but let's just say if I went to the casino, I'd probably pick black on craps. Black on roulette, because it's about almost 50% probability I'll get my money back. And so doing this exercise or taking this pattern of extension first is a really easy win with a lower probability of a failure rate, but everybody can have a little bit of an issue with this. And a lot of times people will honestly scare themselves out of the movement because they feel like it will create a problem. Will it create a problem? Very rarely. And the cool thing is, if it does, you just do the direct opposite and you're back to the set point that you were in. If you're overall scared of movement, don't do this. The last thing you want is for you to have an issue and have a problem. But if you feel like, hey, I just want to try something, this is a really good starting point. The exercise is really benign, all right? I have not had anybody who has gone through the reps and paid attention to what their body is feeling ever having a long-term detriment. But if you don't pay attention to what your body's pain level is saying to you, then yeah, then you can have some issues that will arise from it. But pay attention to what your body's saying. Pain is literally your asset in this. It's your body telling you what's going on. Pay attention to it. It won't mislead you. So the first thing I like to have people do is do a little bit of self-assessment. And so let me make sure this Zoom is following me here. So what this might look like is I might bend forward. I might go backwards. I might go turning. I might go side to side. I might squat. I might lunge, whatever. It doesn't really matter. It's unique to you, and a lot of people will know beyond reasonable doubt what usually makes it so it feels a little iffy. Most people, bending forward is a problem, and so I encourage people to pick the one that you know, I wish this was better, it's a little painful, and then all we're gonna do is test that after we do the long test, assessment, but also therapy. And so what I usually have people do is I have them lay on the ground. I'll use my table for this. And I just have them lay first in a belly down position and just relax like you're reading a book is all. Don't do anything, just lay here, just breathe. Okay, breathe into the belly and out. So if you're not already, do this with me. Test your movement, do this with me. If you don't test your movement prior, then you will have no idea whether this was helpful or not. You have to have something to measure against, okay? So breathe in and out. In, and out. 3 more breaths. In the nose, 6 seconds out the mouth. In the nose, out the mouth. In the nose, out the mouth. So if we know in this position that things are fairly settling, like it's not really bothersome, it might be a little bit pinchy right here, that's okay. But certainly nothing's going down into the hip or the hamstring or the calf, then most people are pretty good in this position. Now we're going to challenge more extension. As you see, my low back is in extension at this point in time. So this amount of extension doesn't bother it, so we're going to challenge just a little bit more in just a touch and go type of fashion. If there's a little bit of pain when you're rising, just tap it, come down, tap it, and come down. All we want is it's okay to have a little discomfort when you're doing this, but what we don't want is lasting problems after doing it. And we're gonna know that this thing is not good for you if it starts to move down your leg. If it's just a little sticky in the low back, I would ride it out for just a little bit and just see. Normally 1 rep won't change what you're feeling. 2 reps won't, 3 won't, 5 won't, 10 won't, but usually 20s and 30s and 40s will. But at the same time, it can actually make it so it becomes a little bit worse. Again, a test. If it makes it worse, it just means this is not the right remedy for you. We have other ones in the book. So I have people put their hands underneath their shoulders and push up. Now you might be thinking, whoa, that's too high. I can't go that high. That's okay. Do this. Okay. What I care about most is amplitude. How high can you try to get every time? It's not about how quick you do them. Okay. I want amplitude. How high? Pause. How high? Pause. I'm going to do 10 on this. Go as high as you can, not how high I can. And it's important to note, keep going by the way, it's important to note, don't use your low back, use your arms. Your triceps and shoulders should be pretty sore after this, totally normal. There's another way to do this too. Okay, say that was 10. Next I'm going to use a different type of extension pattern just to drill this thing out a little bit more to spare the arms. Don't bend your elbows, keep them straight. And just drop the hip pocket to the table and come back out. You might only be able to go here. That's fine. Go as far as you can, not how far I can. I'm just showing you the range that I'm going. I'm showing you the direction that I'm going. Okay? And I care about the amplitude, not the repetitions yet. And so we're going to go 10 just like this. You might notice that there's a little pinchiness there, completely normal. And you might notice that you actually feel you're going through more range. You might have started here, but as you start to breathe and relax, you get down into here. That's great. Good stuff. Okay? And so I'm just going to do about 5 more. I feel that my back's settling down a little bit too, because I woke up with a little back stiffness as well. So you can get better. Okay? I'm going to do a couple more. Do them with me. And as you get off the ground, the important thing is use your legs and arms. I'll demonstrate here. Just make sure you crawl, push, up, and then lunge to stand. Obviously, I'm on the table, can't do that. But now we immediately retest. Immediately. Does this make movement feel pain-free and better? If it does, by 30%, then we're probably on the right track, okay? The magic is in the repetition, doing it throughout a period of time, not necessarily just doing it once. And so usually when this works for people, I set certain parameters of how many times to do it, when to do it, based upon how they present. If people aren't super acute, I won't have them do it that much. If they're really acute, I might not have them press up, I have them lay on their belly. But there's ways to modify this slightly based upon your exact problem. And so this is all in the book, by the way. Just go through and get the book. Link below. Okay, I know you're probably tired of hearing about it, but link is below. I created this specifically because a lot of you get stuck in this point. So that's number 1. And so again, you might be wondering, 30%, big deal. I've gotten that before, with doing massage and chiropractic. Yeah, but have you ever done it on your own? This is super money saving, okay? And also too, because you can do it so often and so many times on your own, you increase the volume and you increase the progression of how little you feel pain. And so the magic in this is being able to feel pain less than you actually feel it. And so if you feel pain 100% of the day, then if you get it down to where you only feel it half the day, that's a big improvement. And it's the way out of getting this thing to become chronic and affect your life even longer. So this is our progression of our sloppy cobras. It is in the book. Again, it's under the pain modification chapter. Again, there are other pain modifying ways too. Again, in the book, I won't be covering them today. If that works, I like to take immediately people to a bird dog exercise. And so I have them go hands and knees. Again, this is progressed as well. Not everyone can do a full bird dog, but if they can, I know that we're well on the track of them feeling better within just a couple days. And so the first thing we have them do is find a position with the pelvis that's comfortable. They might find that this hurts, but that doesn't. Just go in the middle somewhere and then lock it out, okay? First thing we do is check the arms. Go arm long. I'll scoot down so you can see. Arm long, not up, okay? All right, I'm trying to create a long distance from the hand to the foot eventually. I'm not trying to create an arc. Biggest mistake people make is they try to create that arc and they're trying to get big. I don't care about big, I care about long, because we're trying to create a long line between the hand and the foot. So, hands right underneath the shoulders, knees right underneath the hips, push up. This should be pain-free in this position. If it's not, find a pain-free position. Remember, use pain as your asset. That's the chapter 1 in the guide, using pain as your assets. And so, hand up, squeeze the hand really firmly. I'll scooch down just so you can see my hand. Squeeze, 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 squeeze. Okay, it's okay I'm not way up because that hurts my shoulder. I'm gonna go as long as I can. And then on the bottom half, we're gonna go the opposite leg. For demonstration purposes, I'll do the same side leg that's in the camera. So we're gonna go long. If you can draw a line from my ear to my heel, perfect. And we're just gonna hold it there. What I don't want is this kind of thing, all right? This just creates more of a problem. So a therapeutic exercise is therapeutic because of how you do it. It's not the exercise itself. And so in this type of back pain, we have to create a long line, okay? You see my heel getting long, my hand getting long, and I'm just looking straight at the ground when I'm doing so, okay? Some people can only do hand and slide the knee. That's okay, okay? Because sometimes what we find is that when people slide long, they kind of drop. But be in the true light of keeping this like as a full length thing, then I'm just gonna do a couple reps with you, okay? And I'm gonna assume you can do the whole thing. So here, get tall, go long, hold for 10. Drive the heel through the wall behind you. Don't be pointing the toe. Heel through the wall behind you. You should feel your buttocks and your shoulder. Hold, hold, hold. Now when you come down, slowly, 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 like you're balancing glass on your back, and up. Breaks are super minimal, okay? You don't want a long break. And so I'm gonna hold, hold, hold for about 5 to 10 seconds. Then I'm gonna slide down and go again. Notice I'm not moving a lot. It's just I'm moving at the hips and the shoulders or the arms and the legs. I'm not moving from the spine because we're trying to create that callus, okay? That's 3 on one side. We're gonna go through the other side. Long, long, long. I'll be looking at the camera a little bit just so I can kind of see where my hand and feet are for you guys. But even I have a tendency of getting up like this, so I'm gonna go a little longer. Notice my toes are a lot closer to the ground, okay? And so you can actually slide long, toes drag on the ground to get long and then pick up slightly. So that even looks better on me right there. So I'm gonna hold for 10 seconds. And just breathe. Learn to love your therapy. Learn to love your rehab because you'll feel good after, okay? I love doing my rehab, which isn't a rehab anymore because I feel really good. And I love to do weight training. I love to put a load into my body, which is basically doing weight training because I know how good I'll feel after, okay? And so those are 3. I'm sweating already, and I bet you are too. And that's the bird dog exercise. It's one of the foundations of helping people get over lower back pain. That is in the build a support section of the book, it's just part of the A section of the MAP A load process. So now let's go into a recap of what else there is. Now I hope those exercises worked well for you. Remember, those are just a few. Those are 2 of the 6 that I really like to use as a starting point for people, okay? This can work for men and women, and it's people who really want to put the time in and make it so they don't feel like their back is weak forever, okay? Your back can get better. I've had 2 disc herniations over my lifetime. I had one at 18, it was 17 or 16, another one at 35. And so I've dealt with this a couple times and I've asked for help. When I struggled to do it myself, I asked a friend to help me out through it. And once I asked for help, it was light years better. And so if you struggle with this type of thing, just know that, again, these are 2 of 6 things that I like to implement. Again, you can get the book below. Go ahead and scroll all the way down. There's a link. It's free. Just pay for the shipping is all I ask. I don't want to make sure, I want to make sure I'm not going to lose a fortune by giving the books away. I got to cover a little bit of cost. And so just pay for the shipping. But remember, if those don't work, it doesn't mean we can't help you. At our clinic, we would love to help you out. We're in Orange County, California. We do also have online types of services as well. And so the cool thing is, if you'll see by the exercises we showed today, if there was even a little bit of improvement, you should see that movement can dramatically help you. It just comes down to selecting the right movement. Movement is like medication, all right? You pick the wrong movement, it can make you a little worse, but you'll get better. But you pick the right movement, all of a sudden magic happens. It's like the first time you took Advil when you had a headache, all right? Magic happens. I remember my girlfriend took cough syrup for the first time, and she was coughing at night. She said she slept like a dream. But you take the wrong medication like Pepto-Bismol, it has no effect whatsoever. So make sure you're picking the right movement medication for you. We can help you do that. Again, just contact us. There's a link. It's going to come across our website, or call us. We're very friendly. We're helpful. We'll check your insurance. We'll do everything we possibly can to get you off on the right foot. Again, I've had back pain a couple times, and I've met a lot of people who have had back pain. I know how frustrating it is. I know how they get shuffled around looking for MRIs and x-rays, and people tell them to rest too long. I get it. I've been there, okay? I fully understand. But if you go down this path that I'm talking about, you're probably gonna get better. I can't say for certainty because I don't know you. I haven't met you. I haven't examined you. But I'd say easily 95% of the people that I see in the office in person, I'm able to examine them. I'm able to look them in the eye and say, you're gonna be okay. Just do what I'm asking you to do for about 12 to 16 weeks. You'll be okay. Okay? So get the book below. I created it specifically for the situation that you're in. Go all the way down to the bottom or click on the link in the corner and we're going to send it right to you. Hope that was helpful. See you soon.